Good morning, it's Dr. Bungie bringing you back to the fascinating world of evidence-based medicine, now looking at the more uncommon prognosis trial. Uh, as opposed to the more common trials we've looked at, mostly therapy trials, and we've looked at some diagnosis trials. We're going to look today at prognosis. Um, so, what are the components of EBM that we're trying to approach? First, we ask the appropriate clinical question. Asking a good question leads to a good answer. Then we find the evidence. That's doing our search, our literature search. Then we do our critical appraisal, which we would do in our small group sessions, where we find the quality and of the article that we found, making a decision based on the literature, and then evaluating how we're doing in all these other processes, moving on to research. First, we're going to do the question. We want to use our PICO form, which helps us to create a good clinical question using patients, interventions, comparators, and outcomes. Do that with this patient. We have a patient is an 80-year-old male. He's got a new diagnosis of rheumatoid arthritis. We want to tell him what kind of mortality increase he's got from having this disease. So we're going to put this into the boxes. We got 80-year-old male as the patient. In this case, it's not really an intervention, but it's a prognosis. So we're going to say new rheumatoid arthritis diagnosis is our test case, and the comparison is somebody who doesn't have rheumatoid arthritis, and the outcome is death. We could also look at disability, but we're going to try to find mortality. So putting that back into English, in an 80-year-old male patient with a new diagnosis of rheumatoid arthritis, what is his risk of death or disability compared to people without rheumatoid arthritis? So how do we do this search? Well, here's our library website, and as to review this, of course, we want you to be familiar with multiple resources here, and this is of course just a review. And then don't forget, if you can't find a journal article, you can go here and request an article. New thing here is the evidence-based medicine resources we put on there for you. From that, we'll give you the TRIP database and a few other resources, including our PICO form. So let's go to the TRIP database and ask our question. So here's the TRIP database, which you could just also go from by tripdatabase.com. It has a PICO search, which you can click. So in our PICO format, which I just filled in the boxes, elderly male, rheumatoid arthritis versus normal, and mortality. And we'll see what we get. Mortality, and we immediately got at the top a trajectories of functional limitation of early rheumatoid arthritis and their association with mortality. So there's we're going to click on that and see what we get. We have some mention of the health assessment questionnaire right here, and we have some division of how to divide up rheumatoid arthritis patients into their function, and not a whole lot about mortality, so too exciting on that. And plus, we're limited because it's not in our library, so we'd have to specially request that, and it's not in our online resources. So after that, and then I looked in PubMed for a while, then I did what all of you do. I went to UpToDate, which is not wrong. We're trying to encourage you to do some other things, not because they're necessarily better, but just for your variety. Not every answer is in UpToDate, but oftentimes it is. So I looked in UpToDate on rheumatoid arthritis prognosis, and looked under the mortality section of that article, and they summarized some other research for me, of course, and gave us the standardized mortality ratio, and mentioned that which is really a comparison between the mortality in a study and general mortality, not really adjusted, or an internal comparator group, which is in a lot of studies. But then I did a backward search to see if I could find some more details. So that's where you take what their references are and search them yourself. So if you click on here, that box, that gave us the list of references here. I found a article from Wolf et al. 94, mortality of rheumatoid arthritis. So you can click on PubMed here. This took me to the article, but I wasn't too excited about it. It had more standardized mortality ratio numbers from various places in the article, which again tells me that they didn't have an internal comparator group. So I looked around around and I said, don't forget about this area over here, which is related citations in PubMed, where PubMed is got a computer that tries to guess what you are looking for when you found this article, and see if it can give you related things, and maybe related to what you're looking for, or maybe this is actually what you're looking for. So close up on that shows us another article predicting mortality in patients with rheumatoid arthritis, which wasn't in the up-to-date references. Actually happened to be by the same person, Wolf, over here at the same center. And I thought this was the most interesting article, and maybe not exactly answer the question, but also interestingly mentioned the health assessment questionnaire. So anyway, the other useful thing on here is that we had a free full text online, so clicking on that gave me the whole article right here. So this was the article I decided I was going to look at in a little more detail. And then, so we go on, so that's why I found some evidence, want to do our critical appraisal. So if I'm looking at my article, which I'm going to skip over kind of reviewing that article because you guys are doing well at that, you know how to do that. But what are some specific questions I can ask about a prognosis kind of article that will help guide medical appraisal? Well, we've got some resources for you here on our website. So if you look on the Internal Medicine Residency webpage, go to Share Documents there, and then you go to this area that includes EBM, as you can see. And unfortunately, you have to go again to EBM, and then you can find this Tools for Critical Appraisal. Put some things on here. This is from the Strauss EBM textbook. It's got some worksheets, and so worksheets up here and some cards with questions down here. And two of them are about prognosis. Pulling up those, here's our question in a worksheet form in a Word document. Here it is. So I started filling in this prognosis worksheet, working from the article that I had. So the question, was a defined representative sample taken? Not really clear because it wasn't referenced as how long they had rheumatoid arthritis. It was all the people who came into this one center over several years, and then they were followed over a 20-year period. So was the patient follow-up sufficiently long? Well, yes, they followed for about 20 years. Was the objective outcome criteria applied in a blind fashion? Well, yes and no. It wasn't purposely blinded, but the data was reviewed later, so it wasn't gathered in the sense of attempting to specifically get prognosis, kind of. So not great on that. Then the next question is, subgroups with different prognosis are identified. Was there adjustment for important prognosis factors? Well, there was no adjustment for non-rheumatoid arthritis factors, such as underlying heart disease or whatever. But those things were examined in the test because of this prognosis examination of the various, there were many various issues that were examined, but they weren't adjusted for that. Was there a validation group? No. So this was, and none of these articles for prognosis had any specific group. They were just kind of tied to general mortality. So that, I think, so are the valid results of this prognosis study important? Well, specifically, how likely are the outcomes over time? Are likely because it had a large number, 1,300 patients. Many factors were assessed to see if they were associated with mortality and disability. How precise are the prognostic estimates? Not really known, because again, they didn't have a specified control group. They didn't control for a lot of things. Can you apply this valid, important evidence about prognosis and care for your patient? Yes, he has a rheumatoid arthritis. Was he different? Maybe. He was diagnosed in 2014, but not in 1984, so things may have changed. And would this affect what you're offering to the patient and telling the patient? And I would say yes. Other ideas, things I thought of from this and going through this worksheet, is that the health assessment questionnaire, which was developed in the 70s, had the most prognosis value for mortality, which is the main discovery of this paper, with a odds ratio of 2.93. So really comparing to the people who did not have that high score on the hack, but still within that group, these people were 3 times as likely to die, basically, Um, and this was much higher than all the other measurements that they did, including X-rays, rheumatoid factor level, joint involved, age, and other things that they looked at to try to get a prognostic indicators in rheumatoid arthritis. The statistics were weak. The mortality, again, from other studies was quite variable overall, from 1.5 to 2, like I said. And so that discovery was that for me, that it wasn't as high of a mortality that I had previously thought, and that had been previously taught to us from previous studies. Note that over a 20-year period, only 212 people in this group, which was actually not 2,000, it was 1,300, over 20 years died. So if you use that straight information, only 15% of these patients died. If my 80-year-old patient only had a 15% dying over 20 years, that's pretty good shape. But that's a real stretch of that data. But just to make the point that is the mortality maybe not as high as previously thought. All right, so that's our little bit of our critical appraisal, how to use the worksheet specifically for prognosis trials. And if that didn't apply, maybe it wasn't great prognosis trial, but that's the whole thing about prognosis trials. It's hard to find great prognosis trials and make sense of them, but this is how you do it. And one of the reasons for doing this video is that probably some of you had trouble finding prognosis trials and maybe didn't do one, and that's fine. But next step here is to make a decision. And I made two decisions based on the results of my research here. One was to use the health assessment questionnaire, which is basically some basic questions about your activities of daily living. I didn't find much on the web to help me out, but I did find this website from India, which you can score the patient's abilities and basically do the health assessment questionnaire, and then use that to help gauge prognosis. Secondly, that I could tell the patient that the diagnosis of rheumatoid arthritis is not a death sentence. It's increased risk of mortality, but probably somewhere between 1.5 to 2.5 higher likelihood of mortality over time. But that depends on your baseline mortality. So if it's not that high, it's not 10, 20 times risk. So those are the two things that I thought from that investigation. How to evaluate the performance? A couple things I noticed that, of course, looking it up to either just quicker, but going a little bit deeper and doing a reverse search sometimes can be helpful. And this is how you evaluate performance. Look back on how you did on your investigations and your critical. And then moving on to research, which is what we want the residents to do, where you're working on R2 and R3 education for this purpose, getting a little more into the statistics and helping people out on that road. So move to your small groups, talk about your articles, do your critical appraisals. Remember, it's part of a bigger picture. Try to do some math with each article as appropriate, and grow in your understanding of base statistics. Have fun.